Dengue in pregnancy and labor. Admission is required, and close follow-up with the CBC daily is very important for the pregnancy and labor. Gestation and the phases of the dengue are important factors in determining the management. A multidisciplinary team consisting of obstetricians, physicians, and anesthetists and pediatricians should get involved in the management. When a suspected dengue febrile patient is first seen, look for warning signs and admit if any one of them. If admitted to the obstetric ward, urgent referral to the physician is essential. Expansion to the family members over the course of DGHS and the management is important. The signs, symptoms, and lab investigation may be confused with other complications of pregnancy, such as toxemia, means the PAD, or pregnancy, toxemal pregnancy, and HELP syndrome, hemolysis, elevated liver enzymes, and low platelets. It is essential to consider the possibility of dengue in patients with the features of HELP, increased incidence of abruptio placenta, and death in utero, and prematurity are reported. So what is the dengue in pregnancy? In pregnancy dengue, one of the important concerns, yes, one of the important concern, if I'm saying, yes, my dear doctor, that is the PAT, means the preeclamptic toxemia, or the eclampsia, eclamptic toxemia, PAT, and once again the HELP is the PP. So the P for PAT and P for HELP is the P, and these two are very close. So once again, these HELP features can be very close to the dengue. So multidisciplinary management is really important. Complications can be happen. You see, the premature fetal loss and vertical transmission dengue infection may be one of the grave fatal complications in pregnancy. So premature fetal loss or vertical transmission. Vertical transmission in fetus is evidenced by fever, thrombocytopenia, raised liver enzymes, gastric bleeding, pleural effusion, and convalescent rash, and dengue-specific IgM positive. The important maternal complications include the thrombocytopenia, raised liver enzymes, febrile illness, gum bleeding, bilateral pleural effusions. Moreover, uncomplicated pregnancy may be complicated with dengue hemorrhagic fever. Delivery should be conducted in tertiary hospital where all advanced facilities are available. The normal physiological changes in pregnancy make the diagnostic assessment of plasma leakage difficult. Therefore, the following baseline parameters should be noted as early as possible on the first day of the illness. Subsequent management will be based on the change of the baseline levels. So what the things that you need to know: the pulse and the pressure, and the pulse pressure. Once again, the baseline BP is often lower and the pulse pressure is wider and heart rate may be higher. The CBC, the hemoglobin, hematocrit, means the paxil volume, and platelets count may be lower than in non-pregnant patient. SGPT and SGOT, clinical detection of pleural effusions and ascites, means the plasma leakage may be difficult due to the presence of gravid uterus. Use of ultrasound scan to detect the following is advisable: pleural effusion, ascites, gallbladder wall edema may be seen in both DF and DHS. Generally, the presentation and clinical course of dengue in pregnant women is similar to that in non-pregnant individuals. The fluid volume for the critical period for a pregnant mother should be calculated based on the weight prior to pregnancy. So yes, my dear doctor, that you need to know the parameters, the same parameter: pulse pressure, as well as paxil volume, platelets, and SGPT, SGOT, pleural effusion, ascites. Ultrasound scan should be done. Management of the pregnant patients close to delivery. Risk of bleeding is the highest in the close to delivery. Plasma leakage. Unless to save mother's life, avoid lower uterine segment cesarean section or induction of labor during the critical plasma phase. So yes, they avoid the LUCS and induction of the labor during the critical phase. Obstetrical procedures such as the amniocentesis, the external cephalic version, should be avoided. So obstetrical procedures also should be avoided. An obstetric procedure are to be undertaken, maintain the platelet count. Yes, above 50 lakhs. Single donor platelet transfusion is preferred if available, if platelet transfusion is necessary. If platelet goes into the spontaneous lever during critical phase, takes the steps to prevent the vaginal tears by performing the episiotomy. In case of fetal compromise, priority should be given to the mother's life, and decision making should involve the multidisciplinary counseling with the family on the probable outcome is essential. Management of the patients with the dengue with the immediate postpartum. Dengue fever should be suspected in patients having fever in the immediate postpartum period, since this may be overlooked. Early referral to a physician is recommended. Dengue in the elderly is another special situations. Little is known about the dengue in the elderly. Clinical manifestation of dengue in the elderly is similar to those of young adults. However, rash, hepatomegaly, mucocutaneous hemorrhages are less frequent, but GI tract bleeding and microhematuria are more common. Elderly have significantly lower incidence of fever, abdominal pain, bone pain, and rashes, higher frequencies of the concurrent bacteremia, GI bleeding, acute renal failure, and proliferation, higher incidence of prolonged proton time, and lower mean hemoglobin levels than younger adult patients. The higher incidence of the plasma leakage, yes, and case fatalities has been reported in the elderly compared to the young adult dengue patients. Issues in the management: about 10% of elderly dengue patients may have no complaints of fever. Higher rate of acute renal failure. Yes. The impact of increased comorbidities, aging-related decline in cardiopulmonary function is another important consideration during the fluid replacement and or resuscitation in dengue illness. Complications such as congestive cardiac failure and acute pulmonary edema may occur. Frequent assessments and adjustment of the fluid regime are required to avoid the minimize such complications. So dengue in the elderly, the prolonged proton time, higher incidence of plasma leakage, and once again the pulmonary edema is more complications or more occur in dengue in elderly. To indicate hypovolemia. Knowing the baseline heart rate before the dengue illness is helpful in hemodynamic assessment. The impact on hypertension. The continuation into hypertensive agents during the acute dengue illness should be evaluated carefully during the plasma leaking phase. The BP lowering effects of these agents and diuretic therapy may exacerbate the hypertension and hyperperfusion of intravascular volume depletion. So yes, regarding the hypertension patient, one of the important talk to math that should be considered is hypertension is declined by the 40. And regarding the beta blocker and the calcium channel blockers, that should be monitored because of beta blocker bradycardia, occasionally tachycardia. So yes, the baseline heart rate before the dengue illness is helpful. Diabetes, mellitus, and dengue hyperglycemia results in osmotic diuresis worsens the intravascular hypovolemia. Not correctly in the hyperglycemia state exacerbate the shock state. Hyperglycemia also puts the patient at risk of bacterial infection. Diabetic ketoacidosis and hyperosmolar hyperglycemia. Clinical manifestations of diabetic ketoacidosis and hyperosmolar hyperglycemia are similar to that warning signs of severe dengue. It is not uncommon for dengue shock to be misdiagnosed as diabetic ketoacidosis. Hypoglycemia may occur in patients that are taking oral hypoglycemic agents but who had a poor oral intake. Hypoglycemia could be aggravated by severe hepatitis from dengue, oral hypoglycemic agents. GIT absorptions of oral hypoglycemic agents are unreliable because of vomiting and diarrhea. During the dengue illness, some hypoglycemic agents such as metformin may aggravate the lactic acidosis, particularly dengue shock. These agents should be avoided and discontinued during dengue shock and also in those with severe hepatitis. Dengue patients with the known diabetes mellitus should be admitted closer monitoring of the diabetic as well as the dengue states. If the patient has a gastrointestinal disturbance, blood glucose should be controlled with the intravenous short-acting insulin during the dengue illness. A validated protocol for insulin dose adjustment to a targeted glucose level less than 150 mg per deciliter or less than 8.3 milliliter should be used. So 8.3 means 8, just remember. A source of glucose may be maintained once the target is achieved. while receiving the intravenous insulin. Blood glucose should be monitored every 1 to 2 hours until the glucose values and insulin rates are stable, then every 4 hours thereafter. So somebody talk for the diabetes. Yes, diabetes and dengue, there are some issues, hyperglycemia and hypoglycemia, both issues. Diabetic ketoacidosis are confused with the dengue shock, and hypoglycemia is aggravated by the dengue shock as well as the hepatitis. And also the management issues are the intravenous short-acting insulin during the dengue illness, and the validated protocol dose adjustment, target glucose level less than 8, that should remember. Patient on steroid therapy for other conditions. In this situation, steroids should not be abruptly stopped, but if necessary, equivalent doses may be given for IV route during the dengue syndrome period. Yes, period. So means the steroid means the IV route should be used. Fluid hypersensitivity anaphylaxis, high flow rate of fluid of room temperature may cause the shivering that needs the fluid to be warmed up to near the body temperature to avoid which may create the discomfort and terrorize the patient to attend due paralyze the management as well. In some instances, the hypersensitivity anaphylaxis may occur, for is the immediate standard treatment hypersensitivity and anaphylaxis should be instituted. General rule: in this special situation, there are upcoming similar unforeseen situations not experienced before, the following general rule may be adopted. Assessment management by the risk versus gain approach, frequent consultations with peers of relevant specialties, if necessary multidisciplinary team management. Patients should be hospitalized under close monitoring and searching for references and evidence of similar conditions. Keep document and evidence for dissemination and publication or communications. Yes, my dear, so the documentation is very much important. Some parts may help for taking some spot decision. There are leukocyte count as a very good prognostic guide in early phase of the dengue infections. Leukopenia less than 5,000. Within the next 24 hours, the patient will have no fever and he will be entering the critical phase. What should not be done is important, as what should be done and what should be done should not be overdone. Hemorrhage during febrile phase signifies dengue fever, with unusual hemorrhage and possibly not dengue hemorrhagic fever. But hemorrhage without fever should be critically assessed for dengue hemorrhagic fever. So one of the important messages, my dear, during the febrile phase, some of the hemorrhage signifies dengue fever with unusual hemorrhage and possibly not DGHS. But the hemorrhage without fever should be critically assessed for dengue hemorrhagic fever. Multiplying hemoglobin level by 3 is usually found to be around the hematocrit levels. Multiplying hemoglobin by 3 is usually found to be around the packed cell volume. Sudden pallor signifies internal bleeding. So these are the pulse, my dear, that should be known. The leukocyte less than 5,000 P45 parts hazard. So here's the 5,000 that will go in the next 24 hours, the critical phase. And once again, the multiplying hemoglobin, the packed cell volume by hemoglobin 3 and pallor. So the 3 P's, the pulse here, the box that will be helpful. So yes, once again, that the some of the pulse, that the leukocyte WCC means the 5,000 WBC, yes, will go into the critical phase. And next P4, here the packed cell volume is nothing but equal to hemoglobin level multiply by 3. Another P for pallor, sudden pallor is an internal bleeding. So another 3 P's that will be helpful to know them very well. Yes, my dear doctor, this is an important pulse here. And when hematocrit cannot be done or is not available, the following clinical tips may help to speculate in dengue hemorrhagic setting. If the patient has had or deep acid bleeding from gut or other sites, possibly is that the patient may have lower hematocrit because of blood loss. If the patient has ordered Surface or mild bleeding, the possibility is that the patient may have higher hematocrit. Sudden unexplained deterioration of hemodynamic status and refractory adequate fluid therapy, the possibility is more of the blood loss and hence low hematocrit level. In any complicated situation, frequent consultations with other colleagues and multidisciplinary team approach are useful. So yes, my dear, when hematocrit level cannot be done or is not available, the following tips may help to speculate the dengue hemorrhagic fever setting. Once again, if the patient has or had deep or massive bleeding from the gut or other side, the possibility is that the patient may have the lower hematocrit, means a massive bleeding, so definitely the lower hematocrit because of blood loss. If the patient has or had surface or mild bleeding, the possibility is that the patient may have higher hematocrit. Sudden unexplained deterioration of hemodynamic status and refractory to adequate fluid therapy, the possibility is more of blood loss and hence low hematocrit level. Dengue prevention and control, yes, it is written very detailed, so you can see them, the integrated vector management and household level actions and community level actions and institution level actions, outbreak response for dengue and dengue hemorrhagic fever. Yes, my dear doctor, and these guidelines, some of the annexure is given here, and the laboratory investigations from form for the dengue infections. So you can use this form very well in your hospital practice. And next is the handouts for the patients with the dengue fever. Very good handouts, and that can be made understand to the patients about their dengue fever and some of the warning signs altogether here, and some of the don't give aspirin or any analgesic antibiotics other than paracetamol. One of the Bengali handouts or the leaflets that can be provided each and every patient here. ডেঙ্গু জ্বর সন্দেহ হলে রোগীকে অথবা রোগীর পরিবারের সদস্যদের কিছু প্রয়োজনীয় তথ্য প্রদান করতে হবে। ডেঙ্গু রোগীর জন্য প্রয়োজনীয় তথ্য: আপনার রোগী খুব সম্ভবত ডেঙ্গু জ্বরে আক্রান্ত। আপনার রোগীকে সতর্কতার সাথে লক্ষ্য রাখা প্রয়োজন, কারণ পরবর্তী কয়েকদিনের মধ্যে ডেঙ্গু রোগ দ্রুত জটিল আকার ধারণ করতে পারে। এই ধরনের জটিলতা সাধারণত 3 থেকে 5 দিনের মধ্যেই দেখা দেয়। কাজেই আপনার রোগীকে জ্বর সেরে যাওয়ার পর পরবর্তী 2 দিন খুব ভালোভাবে লক্ষ্য রাখতে হবে। ডেঙ্গু জ্বর হলে অত্যাবশ্যকীয় কর্তব্য: শরীরের তাপমাত্রা অবশ্যই 39 ডিগ্রি সেন্টিগ্রেড অথবা 102 ডিগ্রি ফারেনহাইটের নিচে রাখতে হবে। এজন্য শুধুমাত্র ট্যাবলেট প্যারাসিটামল আর সিরাপ প্যারাসিটামল খাওয়াতে হবে, দিনে 4 বারের বেশি নয়। প্যারাসিটামল খাওয়ার হিসাব নিম্নে দেওয়া হলো: 12 বছরের নিচে শিশু 1 বছর প্রতি ডোজ মাত্রা সিরাপ 1 চামচ 120 মিলিলিটার, সো 1 থেকে 1.5 চামচ। 1 থেকে 4 বছরের বাচ্চাদের জন্য 1 থেকে 1.5 চামচ 2 চামচ, অ্যান্ড 1 থেকে 5 বছরের বাচ্চাদের জন্য 2 থেকে 2.5 চামচ। সো মাত্রা 15 মিলিগ্রাম পার কেজি পার মাত্রা 6 ঘন্টা পর পর খাওয়ার পর। 2 হচ্ছে কোনো অবস্থাতেই প্যারাসিটামল ব্যতীত অ্যাসপিরিন বা ব্যথানাশক বা জ্বরনাশক বড়ি বা সিরাপ খাওয়ানো যাবে না। রোগীকে স্বাভাবিক খাবারের সাথে প্রচুর পরিমাণে তরল খাবার, পানি, স্যুপ, দুধ বা ফলের রস ইত্যাদি খাওয়াতে হবে। রোগীকে পূর্ণ বিশ্রামে রাখতে হবে। নিম্নোক্ত কোনো সমস্যা দেখা দিলে অতি দ্রুত চিকিৎসকের কাছে যেতে হবে এবং ভর্তির প্রয়োজন হতে পারে। চামড়ায় লাল দানা, নাক বা দাঁতের মাড়িতে রক্ত পড়া, বারে বারে বমি, রক্ত বমি, কালো পায়খানা, ঘুম ঘুম ভাব, অনবরত কান্না, পেটে ব্যথা, অত্যাধিক পানি পিপাসা, ফ্যাকাশে ভাব ও ঠান্ডা ত্বক ও শ্বাসকষ্ট। যদি এই সমস্যা দেখা দেয় তবে সাথে সাথে নিকটস্থ চিকিৎসকের পরামর্শ নিন, তা নাহলে রোগীর মারাত্মক জটিলতা দেখা দিতে পারে। So it's a very good pamphlets or handouts is given right with the guidelines. And X4 is a hypertension for age, is given one of the important skills how to measure that, and another excellent indications and preparing the patients for family members for possible requirement. Indications for whole blood hemoglobin level less than 5 and significant bleeding more than 10% of the total blood volume, and total blood volume of the body is 80 ml per kg. Concealed bleeding manifested hematocrit drop and unstable vital signs in spite of adequate fluid replacement. Dose of whole fresh blood 10 ml per kg per dose at a time. Indications for platelet concentrate. It has been observed that there is a very limited role of platelet transfusion in most of the situations. Fresh whole blood transfusion service, however, it may be required in some special situations, the indications of which may be follow as follows. Very severe thrombocytopenia will need the surgery, the most of the surgery, and clinical judgment treating physician. If the patient concentrate is not available, fresh whole blood may be transfused as per guidelines given under the DGHS management. Preparing the patient and the family members for the blood transfusion, alert, attention, and the collection. Alert when the platelet count less than 1 lakh. Attention, yes, the platelet count is 10,000 or there are progressive unstable vital signs. And collection, tell the patient, the family members to collect the blood, and which may be all possibility will be required at any moment when you found the platelet count less equal 5,000 or there is dropping of hematocrit and unstable vital sign despite adequate volume replacement. Dengue fever or dengue hemorrhagic fever hospital flow sheets. It's a very good sheets that you can use in your hospital's management planning. And dengue reporting form from the practitioner, GP practitioner, anybody practice, they can report them. And dengue reporting from the hospitals or clinic. This is done in the different hospitals, filled up, and this is reported to the concerned authority. The blood pressure tables for the boys and girls and age and height percentile, you can see them. If you need further reading and references is given. Yes, my dear doctor, I have tried my best level to go through the full guidelines, to read them very, very well, and to try to understand, make it to the people to understand very well, and giving some of the important tips and tricks to remember, how to remember these guidelines and how to approach towards our patients of dengue patients and dengue syndrome, and managing the patients of ABC, the group patients, and the appropriate management should be provided each and every patient so that the contributions from the physicians will be great extent in this community and the country contributions as well. I hope that the discussions over the national guidelines will be really helpful for all of the physicians who have observed it, who have presented and also got these lectures. So I hope that, my dear, you enjoyed. Thank you very much.